Thank you, Deputy Speaker. Well, it is Endometriosis Awareness Month, and I want to thank the member for Bendigo formally for bringing this motion to the House to give us an opportunity to highlight not just the issues but also some of the history around the approach to endometriosis in this House, and to go through in some detail the response from the Albanese Labor government. Let me first pay tribute to former member for Canberra, Gabe Brotman, and the work that she did, in partnership often with the member for Maranoa, representing the opposition, on the work to raise awareness in this federal parliament about the impact of endometriosis. Now, we all know that now, thanks to their work, that it takes a huge toll, not just mental and physical health, but in terms of the quality of life for women who suffer from endometriosis. It is a highly individualised disease, the symptoms and impact of which range significantly from person to person. But it's estimated that endometriosis affects at least 1 in 9 Australian women and has an extensive, devastating impact on the daily lives of sufferers, with people experiencing an unacceptable average of 7 years before diagnosis. The pain can be similarly complex and debilitating. Research has also shown that 1 in 2 Australian women experience pelvic pain, and half of those women do not discuss their symptoms with a doctor, despite significant impacts on work or study. Deputy Speaker, I have been in this place for 10 years, and for me to finally be a member of a government committed not just to gender equity, but with a laser-like focus on gender equity and gender data in our health system. And I want to mention the National Women's Health Summit that occurred last week on the 14th of March, led by the Assistant Minister for Health and Ageing, the member for Cooper, Jed Carney. This National Women's Summit came about because there was an advisory council on women's health, and to raise the issues not just about endometriosis, but around the way women are experiencing our health system and the sector, so that we can get clearer data around the way our health system is responding to women's health issues. And endometriosis is like a microcosm of that women are going for, as this says, 7 years before diagnosis. And I know we've heard these stories time and time again in this place, but the fact of the matter is that that diagnosis, waiting 7 years, can have meant that women have missed a significant amount of work, that women can have given up employment because of the guilt they feel about not being able to go to work every day and not knowing when it's going to strike or when the pain's going to be so bad that they can't present for work. So it's incredibly important, and the government's response to this is incredibly important. As the motion says, it acknowledges the government is addressing endometriosis at a national level with a significant $58.3 million package for endometriosis and pelvic pain announced in the 2022-23 budget. This has delivered 22 dedicated endometriosis and pelvic pain clinics around Australia, and the importance of these clinics is quite simple. It brings together an existing practice and brings into that existing practice considerable expertise in this specific area. So rather than women around the country going to their GP or hunting for a GP that understands their condition, they can now identify that if I attend this clinic, even if with only 22 around the country, 22 more than there were when we took office, but you know that there is a clinic where the expertise will be available to you, where you can walk in as a patient and know you're going to be talking to somebody who's informed, who's been involved in the research, who has the practice capacity to diagnose and ensure that you're getting the support that you need. We also have given access to new Medicare-funded MRI scans to assist investigations of infertility for those with severe endometriosis, and we're developing an endometriosis management plan and other measures to better support those affected with endometriosis. I want to congratulate the many endometriosis patients, their families, organisations and health sector leaders for their continued advocacy on endometriosis awareness and education, and say to those women in my electorate, young, middle-aged, it is time to take this disease seriously. to get yourself to the clinics in Melbourne and make sure that you're getting your diagnosis and your treatment run down.